Hello everyone, today we will talk about a beautiful topic that happened a long time ago and was discovered by research from the name of scary scientist David Bruce, who is the discovered the microbe in 1887. Maltese fever is named after discovery of milk as a source invention by Maltese vaccination, and early locusts still can be summits in 87. Okay, we won't say the brucellosis remain a major illness worldwide, although many countries have eradicated brucella appears from cattle in some area. Brucella meltonis has emerged as causes of infection, the species as well in shape and coats. Rabies vaccination campaigns with the REF1 strain P. Meltonis remain the principal cause of human brucellosis. Brucella since also emerged as a unit of infection in cattle. And we won't say also extincted its operestis, the infection of a human, and isolation of a strain of brucella from mammalians has extended its ecological rank. Brucellosis is infection that affects human, a result of transmission of bacterium that causes the disease brucella from animal to human. Effect of many of its shape, coat, pig, dog, and also affect the camels. We won't say the topic, okay, the brucellosis is dangerous. We won't say the symptoms of brucellosis range from mild to severe. If left untreated, can be fatal. A correct of brucellosis uses characterized examination. Use of special treatment lead to cry from potential and does not expose him to serious complications. The brucellosis.
I will talk about etiology. Brucellosis is a zoonotic disease that can be caused by 4 different Brucella species in human: Brucella sui, Brucella miltonensis, Brucella abartus, Brucella caense. As few as 10 to 100 organisms can cause the disease in humans. All Brucella species are gram-negative, non-motile, facultative, intercellular cocobacilli. Brucella species don't form spores or toxins. The animal host of Brucella sui is swine. The host of Brucella miltensis are sheep and goats. The host of Brucella abartus is cattle, and the host of Brucella caense are dogs. Symptoms of brucellosis may show up anytime for a few days to a few months after you have been infected. Signs and symptoms are similar to those of the flu and include fever, chills, loose appetite, sweat, weakness, fatigue, joint muscles, and back pain, headache. Brucellosis symptoms may disappear for a week or month and then return. Some people have chronic brucellosis and experience symptoms for years even after treatment.
السلام عليكم، أنا إلى الثقافي هتكلم عن transmission of brucellosis disease. Transmission could occur in four main ways or methods. Number one is by eating undercooked meat or consuming unpasteurized or raw dairy products. This method is the typical method of infection. Is through the consumption of raw or unpasteurized dairy products, for example milk or cheeses, and from infected animals like sheep, goats, cows, or camels. Method number two is the breathing in the bacteria that caused brucellosis by inhalation. Infection may also result through breathing in the brucellosis causing bacteria, which is brucella. People who work with the bacteria in the laboratories are typically at higher risk. Also, the employees who work in the butcher shop or meat packing factories and veterinarians. Method number three is bacteria entering the body through skin wounds or mucous membrane. Bacteria can enter wounds in the skin or mucous membrane through contact with an infected animal or with an animal excretions, newborn animals and birth excretion. Method number four is person-to-person transmission. It's quite uncommon for brucellosis to transmit or transfer from person to person. It also can transmit by a breastfeeding mother who are infected and transmitted to their babies. Sexual transmission is rarely acute, as well as the transmission by blood transfusion or tissue transplant. It's possible but is less prevalent.
السلام عليكم، أنا هديل الغامدي وحأتكلم عن prevention and control. There is no vaccine available for brucellosis. حتى الآن لا يوجد لقاح لمرض البروسيلوسيس. You can reduce your risk if you avoid eating and drinking unpasteurized milk and cheese and ice cream when you travel. Hunters should wear rubber gloves when handling the internal organ of animals. يجب على الصيادين ارتداء القفازات عند التعامل مع الأعضاء الداخلية للحيوانات. Make sure the meat is cooked well. يجب التأكد من طهي اللحم جيدا.
السلام عليكم، أنا بسمة وهتكلم عن التريتمنت علاج مرض البروسيلا. Administration of effective antibiotics for an adequate period of time is critical in the treatment of all forms of human brucellosis أو مرض البروسيلا. أعطاء المضادات الحيوية المضادات الحيوية فعالة لفترة كافية من الوقت تعالج جميع أشكال مرض البروسيلا في الإنسان. عادة ما يتم علاج مرض البروسيلا في الحالات الغير المعقدة عند البالغين والأطفال من سن 8 سنوات فما فوق بالدوكسيسيلين يعطى بمقدار 100 ملغ dose a day for 6 weeks in combination with streptomycin 1 gram for 2 to 3 weeks. كمان بجانب الستريبتومايسين والمضاد الأول اللي قلنا اسمه الديوكسيسيلين نقدر كمان نعالج هذا المرض بالريفامينبين. الريفامينبين يؤخذ منه مقدار 15 ملغ لمدة 6 weeks وبس. يعطيكم العافية.